I'm using technology a little bit differently than last year. So I extended monitors. Ah, there she is. Hi, can you hear me?
No,
Can you hear me now?
I gotta change. Kelly, can you hear me? I'm sorry.
Yep, I can hear you.
Wait, they can't hear you. I'm sorry.
Well,
I was in a meeting and I completely lost track of time. There,
can you hear me now?
we can hear you. Let me make sure we can see you. Oh, your PowerPoint looks wonderful, Kelly.
Oh, thanks. And you can't see the notes section?
That's a picture you took, huh?
Yeah.
Okay, so do you guys want a big picture of Kelly or do you want the PowerPoint? Okay, Kelly, they're all ready and all of them are here.
Perfect.
Counted for. Thank you, Kelly. Can you guys hear Kelly? Yes.
Can you hear me loud and clear?
Yeah.
Okay. So now we're going to get started. All right, welcome back. Are you guys excited about another year? It's year two. It's going to go relatively quickly. I don't remember much of my second year 21 years ago, but I know it went fast. So hopefully you all had a good summer, ready to go. First, I want to reintroduce the Curry students that are joining us by Zoom. Sonia, Samantha, Vicky, Amanda, Mia, and Tracy. So before we go on to the syllabus and a few new forms, this class is going to be a lot different than your Chronic 1 class. It's not as much body systems or diseases, except for chronic mental illness. That'll be week 7 and 8. Our first section is going to be complexity in healthcare. There are a couple of reasons why we're doing that. First, it's an OCNI meant for us to provide that education week 1. And it gets you thinking systems-wise instead of in the silo, since healthcare is so complex that there's a lot of working parts, but we're going to get into that soon. So we'll start with, I think I have the syllabus coming up next. So I don't know if you can relate to this or not. I think she looks pretty good. All right. Can you see that okay? Yeah. So the syllabus, and I only have this screenshot, could change minorly throughout the term. But this gives you the quiz dates and what they're on. When things are due, I'll go over the empathy assignment and video. You'll notice when you go into Canvas, only the first 2 weeks are available. I'll make them available as I get them completed. Kaplan exams are on there. So I'll let you take a look at that for a few minutes before we go on.
Kelly, where are you finding that?
This one?
Yeah, is that posted somewhere?
Yeah, it's in Canvas. I think it's towards the bottom of the first section.
Under modules?
Yeah. Winter. How was it?
Yes, you so. The actual
And this is a small snapshot of the modules that you get to enjoy. I can kind of read them on my screen, but complexity of healthcare, and that's kind of buried. Let me see if I can move this over a little bit. And there are a lot of topics to that one. End of life care, and that should, does somebody have a question? That should coincide with week 2 lab. Symptoms management in chronic illness, quality improvement, ethical and legal considerations, case care management, a little bit more advanced than last year's. Chronic mental illness for week 7 and 8, a lot to cover. Substance abuse, addiction disorders. And I believe there's only one day, because I think there's a quiz like on Wednesday or something. I'll have to look back. Healthcare systems and finance, that'll be super exciting. And then finals. You have 3 pages for your handbook to turn in, and I have them up here. So the student handbook agreement. I'm not going to go over these a lot. Consent for physical contact and invasive procedures. And the nursing school confidentiality agreement. And I believe those are due at the end of this week. And there should be a Dropbox. Clinical assessment tool, the CAT. It's going to look a lot different than last year. And I'm super thrilled about this because it's only 2 pages. And you don't have to do much with this at all, except when we sign it and give it to you, you'll upload it. But hopefully the clinical instructors will go over this a little bit more. We will fill it in because you'll have your journal to write down your thoughts pretty much, and we'll be reading this. So for midterm and final, that's page 1. And this is page 2. A lot better than 8 pages. Definitely makes me happy. The lab skills checkout form is going to be a little bit different. All 3 terms are going to be on one form. So you don't have to keep track of 3 separate forms. So that's a little bit exciting. And we're not going to go over these in detail because you'll be able to see them. So this is page 2, winter term. And then spring term, just one thing on there. Mock interview for spring term before you start your practical. And I know you guys love multiple answer questions, so this one's for you. And we'll have a few of those this year as well. All right, any questions before we start complexity?
Kelly, so our Dublin still aren't gonna like count against our grades, right?
No, it'll be the same. Any other questions? Cody, question? All right, so the agenda for Monday and Wednesday. Intro to complexity in healthcare. Decent amount to cover. Chronic illness trajectories. And there's going to be one slide, but there will be a lot of information. We're probably going to cut off today at the middle or end of complexity. Comorbidities and acute exacerbations of chronic illness and transitions of level of care. And then Friday, going to be trauma-informed care, ACEs, access to healthcare community resources, family-centered issues and care planning, a little bit different than the family alterations or that one section that we did last year. Self-management for critical ill patients and psychosocial adjustments. A lot of exciting stuff. To the agenda, there are a few things, and Friday towards the end, I'll kind of go over the points that you closely need to follow. And I'll kind of mention it because I haven't built the quiz yet, but I think I have like 11 questions, so I can talk about those. So intricate networks, dynamic complex interactions, emergence, feedback loop mechanisms, and systems thinking. That's going to be kind of a big one. So I'll let you take a look at this for a few seconds, and then I'll go over some more detail. So we're going to start with the patient journey because it all begins with the patient going into the healthcare system. They begin by seeking healthcare services, either through self-referral, physician referral, or the emergency department. Involves triaging to kind of assess the patient based on the severity of their condition. Involves a clinical assessment, including history taking, physical examination, and diagnostic tests. This could be by nurse or MD or family nurse practitioner. A treatment and management. Treatment plans are based on the diagnosis. That can include medication, labs, other diagnostic tests, or surgery if that's needed. Follow-up and monitoring is big. So after the diagnosis and the treatment plan is given, we want to follow up on the patient to see if there's any side effects from medication, or follow-up labs to see if a particular condition is getting better or worse. Provider interactions. Oops, went too far. So we have a physician consultation. Healthcare providers, including physicians, nurses, and allied health. That's like psychiatrists, mental health specialists. Interact with the patient to deliver care, providing counseling and coordinate services. Interdisciplinary collaboration. Healthcare teams collaborate to develop comprehensive care plans involving specialists, therapists, pharmacists, and other support staff like dietitians, PT, OT, faculty operations. Hospital operations include managing various functions, including patient admissions, bed management, operating rooms, emergency departments, and discharge planning. Infrastructure and resources. See if I could talk. Facilities maintain infrastructures, equipment, supplies, and staffing to support clinical operations and ensure patient safety. Quality assurance, and that's going to be, I think, week 4. We'll talk a little bit about that. Facilities implement quality improvement measures, infection control measures, and other patient safety protocols. Then we go to technological integration. The big one is electronic health records. Patient data is recorded and stored electronically, facilitating documentation, which makes it a lot easier than paper. I remember paper days. communication and information sharing among different healthcare professions. Health information systems. These manage administrative functions like billing, scheduling, and regulatory compliance, streamlining workflow and enhancing efficiency. Policy and regulation, regulatory frameworks, reimbursement models, and quality standards influence healthcare delivery, resource allocation, and patient access to services. And healthcare financing, funding mechanisms, including public insurance, private insurance, out-of-pocket payments, impact health affordability, utilization, and equity. Socioeconomic factors, including income, education, housing, and access to healthy food, affect population health. Cultural and linguistic diversity, diversity considerations influence healthcare delivery. Patient-provider communication and culturally competent care practices. So in most facilities, it's mandated, I believe by law, that healthcare facilities have a certain amount of education on culture and differences. Feedback mechanisms. And when you see the feedback loop mechanism later, that's a little bit different than this. Patients provide feedback on their care experiences, satisfaction, and outcomes. Generally, this has been called HCAHPS. Has anybody heard of that? Stands for, and it's a lot, Hospital Consumer Assessment of Healthcare Providers and Systems. And you don't need to memorize that because that's a lot. It's mandated by CMS, who controls Medicare and Medicaid. It's a survey that the facilities send out to patients or former patients to see how satisfied they are. And historically, it's been like it affects like 30% of reimbursement. So hospitals take that into consideration and see where they can improve. Intricate networks. I'm just going to put all three of these up. So connectivity, that could be the electronic health record. Patient information is securely shared between providers and facilities. This enables coordination of care relatively easily, allowing specialists to access relevant medical history and treatment plans. Improved connectivity leads to better patient outcomes. Resilience. Healthcare systems need to adapt and maintain functionality during challenging times, like disease outbreak, natural disasters, or organizational crisis. One example would be a hurricane, and that probably won't happen here anytime soon, but I guess hospitals need to be able to evacuate patients, deploy emergencies. Or emergency medical teams work with local authorities to maintain care continuity. A resilient system quickly adapts, keeps essential services running, and ensures patient safety and staff safety. Robustness, and I can't recall if there's going to be a question on this slide or not, but I think there is. Despite environmental fluctuations and disturbances, robustness ensures that the healthcare system remains functional during any of these disasters. An example would be the flu epidemic or COVID recently. A robust system manages patient surge while maintaining quality of care and preventing resource overwhelm. One example would be when I was managing an ICU in Roseburg 6 years ago. Sometimes the emergency department would be sort of overflowing, and some of the beds would be lacking because there's patients in them. So for the ICU section, since we take care of the most critical patients, we had to do like a surge overhead. So we would have to look at our patients to see who could move out of ICU into a medical bed or who could be discharged from any of the other units. So it was kind of an interesting process because in our daily jobs at the hospital, we don't really think about moving patients. But that would be one example of robustness, having like a surge plan. I'm just going to put all of these up. Dynamic complex interactions. Dynamic interactions in healthcare can occur in multiple levels, influencing everything from the individual patient to broader system level reforms. Individual patient provider interactions. Healthcare providers interact with patients to make treatment plans. For example, when the doctor prescribes medication, they aren't just considering the symptoms of the patient, but also their medical history of that medication and even the patient preferences. So all of that is taken into account. Now, these individualized decisions can have a ripple effect, influencing patient satisfaction, adherence to treatment plans, and overall outcomes. The complexity lies in balancing these multiple factors to optimize care. And we have organizational processes. On the organizational level, healthcare systems respond to challenges like disease outbreaks by implementing new processes. For example, hospitals may adopt stricter infection control policies during flu season or pandemic, which they did during COVID. Do you have a question? Okay. This requires not only updating practices, but also ensuring that the staff are trained and that the resources are allocated effectively to prevent the spread of disease within the hospital. These changes can directly affect patient safety and public health, demonstrating how decisions are made in the organizational level can dynamically impact both staff and patients. Broader systems level dynamics. On a larger scale, and there are hospitals that are part of larger networks, healthcare systems are shaped by government policies and reforms. For instance, the government might implement healthcare reforms to improve access to underserved populations. These changes can lead to improved health outcomes for large groups, but may also create new challenges by increasing demand of the service, which puts additional pressure on healthcare providers. The interaction between policy and healthcare delivery is a prime example of how changes in the system level can cascade down to affect individual and organizational processes. Complex patterns of behavior. Patients with chronic conditions often require care from multiple specialists. Coordinating this care may be challenging, but when done effectively, can lead to better outcomes. For example, a patient with diabetes may need to see an endocrinologist, a cardiologist, and a primary care physician. Probably plus a few more specialists. Ensuring that all the specialists communicate and coordinate care plans is critical to managing that patient's condition. Overall performance and effectiveness of healthcare system. At the system level, technology plays a role in enhancing care. The adoption of the EMR has been a game changer in terms of improving communication between providers. When the patient's information is available to all of the healthcare providers, it improves coordination of care, reducing duplication of tests, and minimizing errors. Can you imagine if they didn't have this kind of communication with EMR? One provider is adding or ordering certain labs, and the patient doesn't really know what those are, so they go to another specialist, and that specialist orders the same labs. So a lot of duplication and extra cost added to that. Linear dynamics. So healthcare outcomes don't always follow a linear path. So small changes can lead to disproportionately larger or unexpected results. One example is introducing a new EHR, electronic health record, to a system or to a hospital. While it intends to streamline processes, it could lead to longer wait times in the ER due to the learning curve of these new EHRs. And the ripple effect happens because every part of the healthcare system is interconnected. Another example is the hospital reducing staff to cut costs, which has happened. Initially, seems like a good idea for a cost-cutting measure, but it could lead to higher patient complications. Fewer staff may result in delayed care, increasing the risk of complications. This could extend to hospital stays, which are a little more spendy, or even lead to rehospitalizations, ultimately raising costs. So I guess one example would be if a healthcare facility decided to cut like discharge planners. So one of their jobs is to determine if a patient in the hospital is ready for discharge, and they can monitor that a little bit closer than the nurse on the floor, let's say, because they have like 4 or 5 or more patients. Cutting that could lead, like this example showed, into longer hospital stays, costing the system more. We have amplification. Small changes can lead to amplified effects throughout the system, resulting in significant interruptions and transformations. For example, a minor policy change in healthcare financing, such as adjusting reimbursement rates for certain procedures, can lead to an amplified effect of patient care access, healthcare provider behavior, and overall system cost. So patient access to care, changes in reimbursement policies may impact affordability of healthcare services for the patients, affecting their ability to access timely and appropriate care. For example, reduced reimbursement rates for certain procedures may limit the patient's choice or incentivize providers to prioritize certain population or patient populations over others. Healthcare provider behaviors. Healthcare providers may adjust their clinical practice, referral patterns, or treatment decisions in response to these changes. One example would be providers may opt to perform more cost-effective procedures or reduce unnecessary tests and treatments to maintain profitability through new reimbursement schemes. Overall systems costs. These changes can influence overall system costs by altering healthcare utilization patterns, resource allocation decisions, and revenue streams. One example, shifts in reimbursement rates may impact financial viability of healthcare providers or facilities, leading to closures or mergers, which in turn can affect access to care and patient outcomes. And I don't know if that's why Bay Area is currently looking for a merger at this point. A dampening and nonlinear dynamic can also dampen the effects of, I'm not even going to say that, leading to stabilization or equilibrium of the system. For instance, regulatory mechanisms or adaptive behaviors may mitigate the impact of external shocks or disturbances. And we're going to talk a little bit about amplifying and dampening here pretty quick. Emergence. So in healthcare, even simple components interacting with each other can result in the emergence of entirely new patterns. These patterns aren't always predictable, and they arise from the system's complexity. One example of this is clinical pathways. I think we brushed over it last winter term, that are tailored to specific patient populations by using data on certain groups of patients, such as those with diabetes or heart failure. Healthcare systems can develop customized treatment plans that are more effective to those populations. These pathways emerge from interactions between patient data, provider expertise, and treatment protocols, leading to optimized care for certain conditions. Identification of disease patterns or trends. Healthcare systems constantly analyze disease trends and patterns by looking at data from multiple patients and healthcare facilities. Trends that are not initially apparent can come to light. One significant example is the emergence of MRSA or some other disease, or the reemergence of previously controlled infectious disease like measles. These trends are identified through the interaction of data from various healthcare agencies and patient outcomes. Detecting such patterns early allow healthcare systems to implement targeted interventions, such as new infection control measures or update to treatment protocols. And this happens all the time in most hospitals. 10 minutes. So we're going to talk about feedback loop mechanisms, a little bit different than one of the first slides. We have positive feedback loops, negative, and adaptive responses. So positive feedback loops, and you'll want to know pretty good because I think there's one question. Amplification again. Positive feedback loops amplify or escalate the changes in healthcare systems. These loops can either improve or exacerbate conditions, depending on the context. The feedback reinforces itself, leading to growth or acceleration of the particular outcome. One example is disease transmission. When infectious disease spread, the more people become infected, the higher the likelihood of further transmission, creating an exponential rise in the number. This is a classic positive loop or positive feedback loop. So remember that. Example 2, technological adoption, like the EMR, as more healthcare providers adopt new technologies, the system becomes more useful and efficient, leading to further adoption by others. The greater the adoption, the stronger the positive feedback effect, driving more integration into the system. And negative feedback loops are pretty much all about stabilization. And I'm going to give a body example here in a minute. For stabilization, negative feedback loops act as or to maintain balance and keep the system from spiraling out of control. These loops reduce fluctuations and help the system stabilize after disruption. One example, and this is not about healthcare systems. Help with some understanding, give a little context. In healthcare, the homeostasis presents the body's way to maintain a stable internal condition, such as if your body temperature goes up to like 104, you give Tylenol, and it comes back down. So that would be a negative feedback loop. Or your blood pressure is really high, take medications, and it goes back down to normal, so it stabilizes. So know the difference between positive feedback loops and negative. The second example would be resource allocation. When hospitals experience high demand, negative feedback loops can manage the allocations of resources like beds for staff to ensure stability and prevent overuse. If resources are strained, adjustments are made to reallocate the beds and staff where needed, maintaining operational stability. Adaptive responses. Healthcare systems may exhibit adaptive responses to feedback loops, where changes in system behaviors occur in response to certain feedback signals. Understanding and managing feedback loops are essential to optimizing system performance, promoting patient safety, and achieving desired outcomes in healthcare delivery and treatment. Example is the development of telemedicine through the COVID pandemic to ensure continued access to care while minimizing. And this happened relatively quickly during the pandemic. And I think it still happens on occasion. I've had a couple of doctor's appointments that were by telemedicine, and I didn't have to actually go in. So adapting to certain issues like that to make some things better and reducing infection. That's kind of what this is talking about. I think we're almost done with the complexity part. Right. So systems thinking, and you want to know a little bit more about this. Holistic perspective. This means that considering the system as a whole rather than focusing on individual parts in isolation. So when we're in a healthcare system working, we're not just the nurse siloed. Among other nurses, we have providers who help with that, dietitians, pharmacists, a bunch of other people coming together to take care of patients. Healthcare systems are highly interconnected. Changes in one area, such as policy or resource allocation, will inevitably have ripple effects throughout the system. The holistic approach ensures that these interconnected aspects are taken into account. And why does this matter? Adopting a holistic approach and not siloed enables healthcare providers, administrators, and policymakers to identify and address the root cause of issues rather than simply treating the symptoms. Example would be addressing social determinants of health, like access to nutritious food and housing, can improve patient outcomes more effectively than just treating the individual health problem. And the of you that are going to be a Bay Area hospital, now I think maybe at Coquille and other places, I think everybody's going to be doing some kind of community observations, right? So maybe like at Advanced Health, you'll be able to see some of this come to life a little bit better than just lecture. So that's going to be beneficial during those experiences. Analyzing interactions involves understanding how different components of the healthcare system influence each other. This might include relationships between policies, patient outcomes, healthcare provider behavior, and resource allocation. An example is a new healthcare policy is introduced to improve patient access to primary care. On the surface, this policy may seem beneficial, but by analyzing interactions with patients and providers, we can determine how this change impacts multiple facets of systems. Patient outcomes, policy might improve patient outcomes by increasing access to preventative care, reducing the need for emergency interventions. Healthcare provider behavior, providers might change their workflow or clinical practices to adopt the new policies, such as incorporating more routine screenings or adjusting patient schedules. One more minute. And then systems thinking. Analyzing these interactions from a systems thinking perspective helps foresee unintended consequences. For example, access to care might inadvertently lead to longer wait times for appointments in the healthcare system infrastructure, or appointments if the healthcare infrastructure isn't adjusted to meet those demands. So more staff, maybe bigger building at some point. And
So with this section, can we find the rating in the article? Versus like,
well, I would go with the recorded lecture, and I'm going to post this PowerPoint with my notes on it.
okay, okay.
I didn't want to overwhelm you guys with tons of notes. I'm going to kind of read.
I was just looking at it like in the rating and it didn't have in
Yeah,
the section you list
the article is,
what we should refer to for this.
I would refer to the PowerPoint primarily for this.
Okay.
Any other questions?
You're gonna have to fill these out during everything. Okay. Just try to keep yourself. Okay. Bye, Kirby.
I haven't even looked at the book yet. I guess PowerPoint, yeah. Can listen to it. Yeah.
Remember,